Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about diabetic ulcers. And a diabetic ulcer is basically, question number one, a wound on the bottom of the foot. And it happens in individuals with diabetes. Typically, they will have some circulation problems, blood flow problems to the foot. They will also have neuropathy or lack of feeling in the foot. And it creates a wound that is notorious for not healing like it's supposed to. And it's actually hard to heal. So by definition, a diabetic ulcer is a problematic wound in the foot that is hard to heal, can have infections, can have poor blood flow to it, can have poor sensation, so it doesn't really hurt most of the time, and often may even lead to a lot bigger problems such as partial amputation of toes and the foot, and even sometimes the leg, if it's not taken care of and not treated appropriately. So the idea is a diabetic ulcer can be really, really problematic if it's not treated correctly. So number two, why do they happen? The biggest reason is because of those three pieces that we brought up. The fact that you have no sensation. So in an individual where you step on something and it gets uncomfortable, you move your foot. In someone that has peripheral neuropathy or has lack of feeling in the foot, they won't feel that. And so they continue to walk, they continue to function, they continue to do things, and they create a blister that becomes a wound, and that becomes infected and ultimately can lead to significantly more problems. So number one is lack of sensation. That's usually the biggest cause. Number two is poor circulation, leads to the fact that you're not getting the blood flow and not getting appropriate blood to heal. The idea is it takes less blood to supply skin that's closed than it takes to supply a wound or a sore in the foot. So you may have a sufficient blood flow as long as your skin's closed, but then as soon as you get a wound, it needs additional blood flow to help it heal. And you don't have that additional blood flow and you start to see bigger problems because of that. And the third is, as a diabetic, often you can't fight off infections or heal wounds as well as you should because the immune system is just not working like it's supposed to. And so you can actually get it infected. It could actually get worse over time and become a lot bigger problem and lead to even severe infection, sepsis throughout the body, those kind of things. So what can you do for it at home? The truth is, if you're diabetic and you have a diabetic wound, my recommendation is you be seen by someone immediately for multiple different reasons. One is because you don't feel it. You don't know exactly how bad it is until someone else is looking at it, especially a physician that can actually determine what needs to be done to help off-weight it, to help ensure it doesn't get infected or treat infection, and to get it healed. So what should you do for it at home if you have a diabetic wound? Probably dress it carefully and plan on getting it to the doctor as soon as possible. And when should you see the doctor? If it's a wound. Truthfully, I would say if it's a wound, especially if it's getting worse, especially if you can smell an odor, or if there's lots of drainage from it, or it's starting to change colors. All of those things are big, strong reasons why you should go see a doctor with a diabetic wound. My opinion, and what my recommendation will be 100% of the time, if you have a new wound on your foot and you're diabetic, you should be seen that day if at all possible. This is Dr. Brandt Gibson. This is your Podiatry Tips Day 179, Diabetic Ulcer or Diabetic Wound.